Riley. I am currently an undergraduate at UCLA studying neuroscience and global health, and I am currently the president of the Institute of Neuro Innovation at UCLA. I am very honored to be here speaking on behalf of all of our very hardworking members to share a little bit about who we are and how we aim to make a positive impact on our community. Under the gracious guidance of the Institute of Neuro Innovation, I&I at UCLA seeks to expand their mission to a wider group of passionate and enthusiastic individuals. Through various projects in research, outreach, and education, we inspire the next generation of neuroscientists. Our current research projects include exploring virtual reality as a cognitive training treatment for Alzheimer's disease, the role of cannabinoids in the central nervous system, the efficacy of various surgical methods on quality of patient life, as well as investigating bilateral rTMS as a potential PTSD treatment. For education, our focus has been on creating informational infographics in order to post on digital platforms with the aim of making neuroscience education more accessible. For outreach, we have had previous projects where we've taught members of the UCLA community about brain waves, as well as other fascinating neuroscience topics such as meditation. And for our future projects, we plan on going to elementary schools and sharing our love of neuroscience with them in order to further encourage engagement with STEM in the future. As you can see, we have a lot of goals within our organization, and we would absolutely love if any one of you would help us achieve them. So a couple ways you can do that is through guest speaking. That could be either on Zoom or in person. We have a large group of students who would be more than happy to hear about the wisdom you can share with them. You could also offer shadowing experiences or internship opportunities. As I said, everyone is very enthusiastic and knowledgeable, and they are more than willing to help you within your practice and learn from the experiences you can offer to them. We also accept donations of time, such as providing your contact information for mentorship opportunities or any questions students may have about pursuing careers within neuroscience. And you can also collaborate with us on any one of our research, education, or outreach projects. So if you are interested, please feel free to either find me later or reach out to us directly through our Instagram account, which is @ini.@UCLA, or over email at ini@ucla@inifoundation.org. Next, one of our research directors, Nadia, will be presenting some of our amazing students, and they are going to be sharing with you research proposals so you are able to directly hear from the next generation of neuroscientists. Thank you.
Hi everyone, my name is Nadia Gambari, and I'm a third-year neuroscience and brain and behavioral health student at UCLA. So our team members, a variety of our club members submitted research proposals, and essentially the top 3 teams were chosen by our board based on a variety of criteria, including general impact, feasibility, and originality. So our first research proposal winner is Darya Rytova, who will be presenting on chronic migraines.
Hello, everybody. Before I start, I just wanted to ask a quick question. I wanted to ask, in this past month, has anybody had a headache? Oh. How about in the past week? How about today? I'm sorry. Now, think of the worst headache you've ever had and imagine it lasted up to 72 hours. And think it happened 8 times a month for the rest of your life. Unfortunately, around 15% of the population deals with this exact problem. A recent US study showed that 17% of women and 6% of men report chronic migraine symptoms, with it peaking at around 40 years of age. Right now, researchers are a bit stumped as to where this exactly occurs. Recent image studying has shown that there's activation in the brainstem region for people who do deal with chronic migraines, but we still are kind of confused about exactly why or where it occurs. So there's still a huge question mark. However, we do know certain triggers. For example, hormonal imbalances, weather changes, or dehydration. But one of the main leading triggers for chronic migraines is stress. And stress is something unavoidable no matter what stage of life you're at. So there has to be some sort of options for people who deal with this long term. Unfortunately, the current options right now is mainly oral medication. And the issue with this is over time, as people use this type of medication, they grow a tolerance to it and they have to up their doses, which means long term there's adverse side effects from using this consistently. So there's not a lot of options for people out there with chronic migraines. And as a person who deals with chronic migraines myself, I remember for years I have been searching for different types of solutions in order to help alleviate my symptoms and the occurrences of it happening. And after lots and lots of searching, there was literally nothing. There was nothing out there about what could help me with chronic migraines. The options were either Advil or a literal lobotomy. So I was trying to look at some other types of options through this proposal more in-depthly to see if there's any other type of solutions for people with chronic migraines. And fortunately, TMS might be it. So TMS is transcranial magnetic stimulation. It's a non-invasive treatment that sends electrical currents in the underlying neural tissue, and wherever you choose to target, it activates that region and stimulates it. Unfortunately, TMS is not advanced enough yet to reach places like the brainstem, but there has been some promising research through targeting the dorsolateral prefrontal cortex area of the brain to show less migraines occurring. So the JMA Medical Journal explains that these devices, TMS, are associated with improvements in freedom from pain caused by acute migraines and a reduction of up to 2 migraine days per month in clinical trials. So this type of study was more for the short term for acute migraines, but the proposal that I'm bringing to you guys today is looking at the relationship between our TMS, or repetitive TMS, in helping with reducing chronic migraines long term. So the way this would be studied would be through randomized controlled trials. Prior to the actual research, subjects over 18 with chronic migraines will track its occurrences over a 3-month period. When the treatment actually starts occurring, Group 1 will continue using their conventional treatment, while Group 2 will use our TMS therapy 5 times a week for 6 weeks, again focus on that left dorsolateral area. And afterwards, participants will track their migraine occurrences again over another 3-month period and see if there were any changes in the occurrences of their migraines. And the data in each stage will include how many times per week migraines occur, if they had to step in with any alternative treatment, and on a scale of 1 to 5, how debilitating it was. Now, the significance of these types of studies, there's a lot of factors because tens of millions of people deal with headache-like symptoms, like you guys all said today. And unfortunately, stigma around headaches forces people to push themselves over their limit at the detriment of their own health. And unfortunately, the long-term effects of untreated chronic migraines lead to cardiovascular diseases, strokes, depression, anxiety, and panic disorders. And migraines are extremely debilitating. People are left unable to function, unable to get out of bed, and again can last up to 72 hours. And which means improving the quality of life for people dealing with chronic migraines could lead to better mental health, physical health, and day-to-day efficiency. But most importantly through this study and why we're all here today is that we learn more about the brain. We learn more about ways to prolong brain longevity and health, and overall help us understand each other better.